Thank you so much for your interest. As you know that this is a two-day webinar. On day one, we will just go through the introduction and about the causes of diastasis recti abdominis and the complications and how to assess it and the treatment. This is a very common complication in pregnancy. But this is not only limited to pregnancy, it can occur in men, it can occur in non pregnant women as well. So, I am Dr. Fariha Khalid. I have done my DPT, MSPT in neurology from University of Lahore, and I am certified as a women health rehab practitioner, and I am practicing in women health from almost 3 years. And currently I am teaching in University of Lahore and doing my clinical practice at Umar Medical Center, Lahore. So let's discuss about the diastasis recti abdominis. Today we will just go through, you can say we will just discuss about the details, and tomorrow will be the practical session. Practically I will tell you about the assessment, the treatment, the corrective exercise of diastasis recti and other exercises that can be done. Diastasis recti abdominis. It is also known as diastasis recti somewhere, or it is also known as diastasis recti abdominis, abbreviated as DRA, or diastasis recti abdominis muscle. If you hear these three terms anywhere, I will repeat the terms diastasis recti, diastasis recti abdominis, which is abbreviated as DRA, and diastasis recti abdominis muscle, which is DRAM. These all are name of one thing, which is basically the separation of rectus abdominis muscle. Rectus abdominis muscle is basically a muscle of abdomen, which is in common we call the six pack muscle. Is basically the rectus abdominis muscle. So here you can see the basic anatomy of the muscle. As you can see in this picture that it is originating from the pelvis, from the pubic crust and from the symphysis pubis. And it go all the way up to the 5th, 6th and 7th costal cartilages and the lower bottom of your sternum. So you can see the basic anatomy. By seeing the origin and insertion, you can see that this is basically the muscle which will help in the flexion of trunk. So basically, as you can see in this picture, that this is the muscle which is basically responsible for the tone of your abdomen, for basically the six packs and the eight packs. So this is the muscle. This play an important role in correction of your posture, in maintaining your low back, which is basically the lumbar area. So any complication or any damage or suppression in this muscle can lead to low back pain as well, which we will discuss in upcoming slides. So basically, what is diastasis recti abdominis? The word diastasis means the separation. Rectus abdominis muscle separation is known as diastasis recti abdominis. Basically, the central line you can see between the left and right diastasis rectus abdominis muscle is known as linea alba, and it is basically a connective tissue which is joining the left side muscle with the right side muscle. If due to any reason that muscle separated from this central line, which is linea alba, a connective tissue, this will leads to its separation known as diastasis recti. And if the separation is more than 2 centimeter, then we will say that it is separation and a complication. But if it is less than 2 centimeter, then this will not be considered as diastasis recti. So this can occur in non-pregnant women as well and in men as well, but this is the main complication in pregnancy. If we discuss in non-pregnant women and men, due to their bad posture, the way they are lifting heavy weights, this can cause the separation of rectus abdominis muscle. Or due to some hormonal changes. So there are multiple causes: malalignment, disrupt biomechanics, inappropriate posture, inappropriate exercises. For example, if someone is doing crunches to reduce his belly or toning up his belly and doing it in incorrect posture and straining the muscle, then this can also lead to separation, but mainly it is a common complication of pregnancy. As in pregnancy, the uterus size increases as the fetus grow. So this causes a stretch in the abdomen, leading to a stretch in the rectus abdominis muscle. And when the rectus muscle will be hyperstretched, then there will be a separation. Basically, in non-pregnant women, according to a study, in non-pregnant women there was no separation of muscle, but in first trimester, 27% women were suffering from DRA. In third trimester, you can say that 66% women were suffering from DRA, and after postpartum, 36 women have DRA. How it is a complication and why it should be treated? Mainly after postpartum, it in you can say in 60% women it recovered by itself, that they don't have to go to for the treatment or some you can say exercise, they it recover itself. But in 40% women, the muscle the separation continues, and this needs attention and it should be treated. So basically, what are the causes that lead to the separation of rectus abdominis muscle in pregnancy? As in pregnancy, there are hormonal changes, and the hormonal changes leads to an increased level of relaxin and progestin. These are basically the hormones which relax your connective tissue, which relax your muscle and create a joint laxity, which is a normal physiological change during pregnancy. So when there is laxity, or you can say relaxing of the muscles, then there is decreased tensile strength, which can increase the chances of damage. So due to the increased amount of relaxin hormone, progesterone hormone, the connective tissue's tensile strength decreases, leading to increased chances of diastasis recti abdominis. It can also develop during labor period, as due to the excessive you can say labor stage and due to the pushing phase, it can also occur in labor. And if there is excessive breath holding, then this can also cause DRA. Then now there are three levels at which DRA can occur. In the first picture, you are saying it is the normal rectus abdominis muscle. In second picture, you can see that at the level of umbilicus there is a separation of rectus abdominis muscle. So basically there are three levels from at which the rectus abdominis muscle can be separated: at the level of umbilicus, above umbilicus, and below umbilicus. The picture 1 is showing the normal rectus abdominis muscle. In the picture 2, you can see the separation of rectus abdominis muscle at the level of umbilicus. And in picture 3, you can see the separation of rectus abdominis muscle below umbilicus. And in picture 4, you can see separation above umbilicus. And in severe case, these all three levels are separated. Muscle is separated from all these three levels, which is showing in the last picture. And the last picture, if the muscle separation is so complicated, then the final or the you can say main treatment required is surgery. But in first three stages, it can be treated conservatively. So basically, a routine assessment of diastasis recti abdominis is required throughout the pregnancy and after postpartum to see that it does not continue after postpartum, and if it continue then it should be managed, as it can lead to many complications, and if it proceeds then in the next pregnancy women have chances, increased chances of fetal damage. So it should be treated, and it is a complication that occur in every woman. Many women it is treated by itself, that after postpartum it just go away, but in 40% women it need attention. But as in Pakistan there is not much awareness about it, no, not many women know that they have to go to physio for the assessment of their muscles. So their abdomen muscle tone is very, you can say, low, hypotonic abdominal muscle. So they need attention and it should be treated. So there are complications. So the separation of rectus abdominis muscle can cause many complications. As you can see, it is the muscle which is controlling the trunk flexion. So on the opposite side, there is the lumbar region which is controlling the back muscles which are controlling the lumbar extension. Sorry, the trunk extension. If there is any damage or any hypotonicity in the rectus abdominis muscle, this can lead to a pain in your lower back. So this should be treated, and if any woman after postpartum in pregnancy comes to you for low back pain, you must check his for her diastasis recti. You must check that is the cause of low back pain is diastasis recti. So you must check it. Then there are further more complications, for example, functional limitations, that the woman is unable to go from supine to sitting position, as this require the contraction of rectus abdominis muscle. And if the woman move from spine to sitting, she feel pain in her abdomen. So this is a functional limitation, that she feel pain in some of her activities, and she has a weak abdominal muscles, and there is a separation, you can say malalignment or mechanical, you can say misalignment. So this should be treated. There is also one more complication, that if diastasis recti abdominis is present, it leads to decreased fetal protection, as it is a layer of muscle which is protecting the uterus. Uterus is basically an organ of pelvis, but in, you can say, in the last of second and third trimester, it become more an abdomen organ. So the muscles of abdomen are basically, you can say, covering and protecting the uterus. So if a layer is separated and there is a gap, you can say a layer just went away, and there is one protective layer is, you can say, decreased from the fetal protection. So it can decrease fetal protection, and it should be treated. If in any woman it's lead or continue after postpartum, then in her next pregnancy there will be decreased fetal protection, and her chances of miscarriage and damage to the fetal will increase. In last, there is one more complication. Potential for herniation. If there is separation of rectus abdominis muscle, then the person, whether it is a man or woman, it is at increased chances to develop hernia. So it should be treated, and if there is herniation, then the final option which is left is surgery. Then it can't be managed conservatively. Just revise what we have learned. We will start the examination, then will go through the self examination and treatment. And if you have any question till now, you can ask. If you have any questions till now, you can ask. Just revise what is diastasis recti, just go through what can cause diastasis recti and what are the complications due to diastasis recti abdominis muscle. Okay, now we will continue further. I'm very glad that it is clear to all of you. In examination, we will there is, you can say, a diagnostic tool that we can go ask the patient to go for the ultrasound. It can show the separation of muscle. Being a physiotherapist, there is a manual method to examine the diastasis recti abdominis muscle separation, and it is one finger method, two finger method, and a three finger method. Basically, we palpate with one finger, two finger, or three finger that is there any separation present in the rectus abdominis muscle or not. So, for, you can say, the more accurate diagnosis, you can go for the ultrasound, or to confirm your, you can say, diagnosis, you can ask the patient to go for ultrasound. But you can also examine it manually. Being a physiotherapist, you can also examine it manually by one finger method, two finger method, and three finger method. There is not much difference in these three methods. The all procedure is same, just the difference is that if you are going for one finger method, you will palpate from one finger. If you are going through two finger method, you will palpate through two fingers, and if you are going for three fingers method, you will palpate through three fingers. The only difference is that these will show that how much separation is present. If one finger is just dipping, it means the separation is narrow. If two fingers are dipping in, it means the separation is more than, matlab, you can say it is quite severe. So we will just come through this picture. This is basically the hook line position, supine with the knee bends. For the examination of diastasis recti abdominis, the patient should be in hook line position. Hook line position is basically supine with knee bending. Then we will ask the patient to slowly raise her head, her shoulders, and try to move her hands toward her knees. This is basically the crunches. If any one of you try to lose weight or follow a workout, then you must know that what a crunches is. It is basically directly the movement of rectus abdominis muscle. In examination, we will ask the patient to contract his rectus abdominis muscle through this movement, and we will palpate is there any separation present or not. This is basically the procedure. That patient is in hook line position. You will ask the patient to slowly raise her head and shoulders slightly, not, you can say, just raise her shoulders till the spine or scapula. And the therapist will palpate through linea alba, the midline of abdomen, that is there any separation present, and how the therapist can feel the separation, that his fingers will sunk in. If he is palpating, the best method is to start with two fingers, that it is a mid method. So start with two fingers, palpate through the linea alba by asking the patient to perform this movement, and see if there any separation present, and how you can see about the separation, that the fingers will sink in. So this is basically the examination of rectus abdominis muscle. How you will document it, that how much separation is present, by telling that one finger method is positive, two finger method is positive, and three finger method is positive. So basically, for the examination of diastasis recti, one finger, two finger, and three finger method is used. one finger, these this basically the number of fingers just show that how much separation is present. The position of the patient will be hook line. Therapist will ask the patient to raise her head and shoulder till the spine of scapula, and therapist will palpate throughout the linea alba, the midline of abdomen, to see any separation present, and then he will document it by seeing that which how many fingers sunk in. If three fingers sunk in, that this show that the separation is more severe, and if the fingers are sunking in throughout the linea alba, then this show that the case is very severe and this needs surgery now. Then the same method is used for the self examination. Usually you can say after postpartum, the doctor asks the patient to go through all this process selfly to see that if their separation is present or not. Same method will be used, but there will be one difference, that the patient's hands will selfly palpate for the separation. Inshallah, tomorrow we will do it practically, so it will be more clear to you. For the self examination, same, the patient will be in hook line position. He will raise her shoulders. She will raise her, you can say, head, shoulders till the spine of scapula. And from one hand, she will palpate that is there any separation present or not. Now, the last point comes as the most interesting, and every physiotherapist want to know, is the intervention. That be to assess it is quite easy. Then, basically, what is difficult or complicated is how to treat it, how to make your you can say intervention plan. So, basically, for the intervention of diastasis recti abdominis, at start you must and you should only ask the patient to do the corrective exercise of diastasis recti abdominis, which we will discuss now. After the separation is filled, the one finger, two finger, three finger methods are negative and the separation become less than 2 centimeter, then we ask the patient to go for core strengthening exercises. I will repeat again that the intervention of diastasis recti abdominis is so basic that at start you will ask the patient to just go through the corrective exercise of diastasis recti, and then when the separation is decreased then 2 centimeter, then you will ask the patient to do the corrective to do the core strengthening exercises. There is one more point, that in pregnancy, if the woman is basically you can say do workout regularly and she has a good abdominal tone, good posture, then there are less chances that she will develop diastasis of his rectus abdominis muscle. Now comes to the intervention. The starting position will be the same, that you will ask the patient, these are all the things which I have tell you, that you will just ask the patient to go to the corrective exercise of diastasis recti until the separation is less than 2 centimeter. This is basically an evidence that in 200 women which were pregnant for the first time, diastasis recti abdominis exercises were used to treat their low back pain. So this showed that the cause of low back pain was basically the rectus abdominis muscle separation. This is the corrective exercise of diastasis recti. You will ask the patient to basically go in hook line position, which is supine with the knee bending, and then you will ask the patient to wrap her arms around her belly such that she is leading her sides of abdomen toward the midline, toward the linea alba, and then she will perform the same exercise, which is lifting of her head and shoulder till spine of scapula. This is the corrective exercise for diastasis recti and it is quite similar to its examination. The patient position is same, the movement is same, but there is the difference in the position of hand that the patient will wrap her hands around her belly. She can just use her hand, her forearms to basically move her muscles toward the central point. And if the patient is obese, then it you can say a pillow or a belt or another support can be used. And of course, therapist can also help in approximating the muscles toward the midline. So this is basically when the muscles is approximated toward the midline and the woman will contract that muscle, then this will reduce the, you can say, direct stress on the muscles and leading it toward the central line. So this is all the procedure. Lie on your back, knee bent, which is basically the hook line position. Cross your hands at your waist. Guide your recti abdominis muscle to midline to stabilize them. That you are basically filling the separation which is present at the midline by approximating the muscles toward the center. Take a deep breath in. As you slowly exhale, perform a pelvic muscle contraction and raise your head off the bed. Keep your shoulders on the bed. So basically, you just have to raise your shoulders till the spine of scapula. There is one more, you can say, important point that in any exercise, when the patient is basically the contracting the muscle, you should ask the patient to do exhale. And when patient is relaxing the muscle, ask the patient to go for inhaling. So, by you can say making a rhythm between the muscle contraction and your respiratory system, increase you can say the efficiency of workout. In any exercise, being a therapist, you are asking the patient to perform an exercise. It is an important point to ask your patient to exhale while contracting the muscle and inhale while relaxing it. And if the person is obese and the tummy is too large, you can wrap a sheet around it, a towel, or any other support, or any other person can basically support the muscles toward the midpoint. Then there is an important, you can say, questions come in mind that how many times we should ask the patient to perform it and how much repetitions. So sets and repetitions are quite more important. So you will ask the patient to perform it 3 times a day with 10 repetitions. And you can also teach your patient about the self examination so she can perform the self examination after 3 or 4 days to check that is it working effectively or not. What to avoid if you have a diastasis recti abdominis? So basically, if a person is suffering from the separation of rectus abdominis muscle, ask her to modify some of her activities. For example, ask the patient do not perform supine to sitting position until the separation is less than 2 centimeter. You should ask the patient that go inside lying and then move towards sitting. Then you can say change your position. So direct pressure on the abdomen should be avoided. For example, lifting heavy weights from the floor or from anywhere from supine to sitting transition. These all should be avoided. The direct pressure on abdomen. The exercises to reduce the abdomen should be avoided. I will repeat again that this is quite important that the patient should only perform corrective exercise for diastasis recti abdominis muscle until the separation become less than 2 centimeter. After the separation is 2 centimeter, less than 2 centimeter, we will go for the strengthening exercises for the core strengthening exercises. Some exercises such as crunches, push-ups, sit-ups, etc. should be avoided as it directly involves the contraction of rectus abdominis muscle. and avoid high intensity exercises so the separation or the condition does not become more worse. Be proactive. Diastasis can be avoided if necessary measures are taken pre and peri pregnancy. And you can see that the during pregnancy diastasis recti is avoided if you visit your, you can say, a physiotherapist and go for strengthening exercises to increase your abdomen tone, then diastasis recti abdominis can be avoided. Practice core strengthening exercises that will help to rebuild the tension in linea alba and ultimately restore the core. So, if to avoid the core strengthening exercises are to avoid the rectus abdominis, diastasis recti, and secondly, they are used after the corrective exercises when separation become less than 2 centimeter. Then they are used to tone up your abdominal muscle to, you can say, strengthen your core to avoid to further avoid any damage. So this was basically the today's topic. Tomorrow we will see about practically about the examination of diastasis recti, self-examination of diastasis recti, and the corrective exercise and some of core strengthening exercises that can be recommended to prevent it and to, you can say, as a treatment plan after the corrective exercise has done his role. So now if you have any question you can ask. You can also share your feedback that if there are any suggestions or anything you didn't understand, you can share. And you can also ask if you have any query, any question. This video will be available for you on this YouTube channel, Physioman PMRC FH. You can watch it. It will be available in 2 to 3 hours. You can watch it if you want to revise it and go through it once again. And this is the Facebook channel you are using to join this webinar. You all are welcome to join this webinar and thank you so much for showing that much interest and response. And there is one more thing I want to say that if there is any topic you are interested to know about the treatment or any topic that you want to know more practically or you can say theoretically, you can just suggest us. We will definitely next time we will definitely go to that webinar. Thank you so much for your appreciation. That means a lot to me. Thank you so much for your time as well, for listening patiently, and you can say for showing that much interest. You all are welcome. I think there is no query. So, tomorrow we will go through it practically. And if there will be any query, you can ask tomorrow as well. So, thanks a lot for your time and thanks a lot for joining us. And sure, I will share the slides with you. So don't worry about the slides. If 2 centimeter separation is present, then this indicate that medical attention or treatment is required. So if there is 2 centimeter separation, then we will ask the patient to go for the corrective exercise. When it reduces then 2 centimeter, then we will ask the patient to basically you can say go to the core strengthening exercises. Inshallah, Mariam, next time we will try to have a webinar on bad posture and good posture. Inshallah. Thank you so much again for your interest. Tomorrow, I See you all for the practical part, and all of you stay blessed. Allah Hafiz.